Uganda established a comprehensive immunization program between 1962 and 70, achieving high routine coverage of infants, especially to polio and tuberculosis. The country became one of the first in Africa to be certified for smallpox eradication in the early 70s, but due to political turmoil and civil unrest in the late 70s and 80s, the coverage dramatically dropped. As a response, in 1983, the Uganda National Expanded Program on Immunization, or UNEPI, was launched to ensure full immunization of infants and women of childbearing age. This registered notable success, as immunization coverage reached 80% by 1990. In 1991, Uganda was ranked among the top 10 countries in the world for improving routine immunization coverage. The policy shifts in the 90s, both at international and local levels, affected management and consequently delivery of immunization services. Internationally, funding of the same programs declined when the focus shifted from routine immunization to global eradication of polio and neonatal tetanus. At the national level, the change of government of Uganda's form of governance towards decentralization meant that financing of operational costs, as well as provision and management of immunization services, were left to the districts. Despite the long history of implementation, the immunization services in Uganda have been operated within a fragmented policy environment. It is therefore against that background that the Ministry of Health prepared the draft Uganda immunization policy, which aims at the following. 1, ensuring the availability of safe, potent, and effective vaccines for targeted diseases among the targeted population and age group. Strengthening coordination, support, and accountability of health management structures for quality immunization and service delivery in Uganda. Increasing access to immunization services by all target groups and ages. Increasing and sustaining demand for the utilization of the immunization services. Improving surveillance and monitoring of disease incidence, trends, and program performance. Ensuring injection safety and proper waste management. Mobilizing financial resources for immunization services in Uganda while ensuring equity, efficiency, transparency, and mutual accountability. Strengthening the capacity of human resource for immunization services, and strengthening a legal and regulatory framework governing immunization services in Uganda. Cabinet therefore approved the above policy, which was in draft form, and it is now already a policy. It therefore authorized the Minister of Health to gazette and disseminate the Uganda immunization policy of 2014.